Hi, everyone. Good evening. Kathy, can you hear me?
Yes, I can. I had to unmute myself.
Great. So welcome, everyone. We've got a webinar tonight that I think you're really going to enjoy. This is Catherine Piers, and the webinar tonight is great follow-up to last week's. Kathy will introduce our presenter in just a minute, but as usual, I'm just going to go over the few housekeeping details. The first is make sure that you are muted. I've just muted everyone a minute ago, so there shouldn't be anyone unmuted, but if for some reason you do wind up unmuted, please make sure that you click the little mute, the little telephone or speaker button beside your name to ensure that you are muted as we go along. The materials, the PowerPoint for tonight has been uploaded to the box that says materials on the right-hand side of your screen in your control panel there. And so if you wish to download and print the handouts out, you can do so from that screen. If you have a question, don't feel you need to hold them till the end of the conversation. You can type your questions in at any point into the chat box, also on the right-hand side of your screen. I'm not sure Kathy's going to follow up on how Michele wants to take questions, but if something pops into your mind, please feel free to type it in there at any point, and we will get to those eventually, and Kathy will be moderating those questions. And I think that's it. Not sure who we're seeing on a webcam. You do not need to use your webcam unless you really want us to see you, but you don't need to. So at any rate, Kathy, I'm going to turn it over to you. And while you are introducing Michele, if you haven't already, I am going to do change presenter to Michele and unmute her.
No, I haven't already.
You have or you have not?
I have not.
Okay, I'm going to pass the screen over to Michele, and I'm also going to unmute her.
Great. Tonight's presentation, our webinar with Michele Carignan, is What Are Your Wishes? How to Have Goals of Care Conversations, is a perfect follow-up and complement to last week with Jean Kerwin. For those you were on with Jean Kerwin, we were talking about medical ethics and ethical issues and defining and discussing what the barriers and issues are at this point. And tonight, Michele is going to talk about some of what are the wishes and how to do the conversation to discuss what those wishes are. This is one of the joys for me in doing this, is getting to know people like Michele, and it's already been a pleasure to learn from her and talk with her, and I'm looking forward to tonight as well. She's a registered nurse, palliative and hospice clinical liaison, and has devoted her 20-year career in raising the level of quality education in all entities of our healthcare facilities. Personally, she has had the privilege of sitting with hundreds of families to discuss their end-of-life wishes. She is a certified dementia practitioner, CDP, assisted living administrator, and a national task group affiliated regional trainer for Down syndrome and IDD with Alzheimer's disease. It's been a few years since we've met, Michele, and so it's a real pleasure to have you on tonight. And
Michele, just click on your PowerPoint. It looks like just click on your PowerPoint. You don't need to do anything with GoToTraining. Just click on your presentation on your screen.
On my
Yeah, just pull it up on your screen.
On your computer.
On your computer.
Oh, pull up my PowerPoint?
Yep, your PowerPoint.
Just pull up your PowerPoint.
There you are. There you are. Perfect. Michele, do you want questions as you're presenting, or do you want to wait towards the end?
We can probably wait towards the end, would probably be better.
Okay, not a problem. Okay, Michele, all yours, and thank you so much.
So welcome, everyone. I'm so honored that you took the time to be with us this evening, and it's going to be a very casual evening because, again, the conversations that we are having are hopefully with your clients. And this is something that I do daily. So I want it to be very casual this evening, and I'd like you to be interactive with me. My goal this evening is for you to be comfortable having the conversation. And I think that's what I'm finding so many people are not. Many of the PowerPoints that I attend and go to and find people at, they go over what the medical terminology is, but they don't teach you truly just how to just relax and have the conversation. So that's my goal this evening. And if you do have questions and you want me to stop, that's fine. Just, again, put it in the type chat, but we'll try to save the conversations to the end.
Yeah, I will monitor those as well.
Yeah, that's wonderful.
You don't have to worry about it.
Okay. So again, with the disclosures, I have nothing to disclose. The relationships and financial sponsors, none. But potential for conflicts, none. My objective tonight is I'm going to have, I'd like to give you 2 gifts this evening. One is for you to experience a session of mindfulness. The next will be to have the conversation, but we will go over a few types of advanced directives, how to define what the definitions are, and then to define some life-sustaining measures. I cannot go on, can't go forward unless I do in memory of Gail and Roland. If it was not for Gail and Roland, I would never have met this beautiful group of people. Gail was my mentor. She was an LPN that I had worked with for years, and Roland was her brother. And Roland had Down syndrome, and we were very close. And Roland started developing personality. He was just becoming a little bit different. And Roland was the love of my life. He loved God and he was so sweet. And all of a sudden he was mad at God one day. And we could not figure out what was wrong with Roland. And it took us years to figure this out. And when we finally figured it out, Roland was diagnosed with Alzheimer's. And Gail and I, as sisters, we're not sisters, but I felt like she was my sister. We set out on a mission to find more education for, with Down syndrome and Alzheimer's and what he was going through. And I could not find anything. I searched and searched, and finally I reached out to people in Rhode Island, and they hooked me up with Kathy and this wonderful group, and we brought education to Rhode Island so we could learn more. And we worked very, very hard. It took 3 years, and before we could get the training to Rhode Island, and it was at Amica in Lincoln, and I was so excited. And Gail and I had worked really, really hard. And I remember being at Amica, and I kept looking for her. And I was looking for Roland, and I was looking for her. She was supposed to come that first day of the presentation, and she didn't show up. And I was so angry, and I could not figure out why she didn't show up. And I left Amica, which is where they held the conference that day. And I got to my car, and my phone blew up. There had to be about 10 missed calls. And when I answered the phone, they asked me if I was sitting down, and it was the day of the conference, and I sat down, and they had told me that Gail was killed in a car accident. And Roland was with her. They were coming home from Florida, and they were in a terrible car accident, and Gail died on the scene. Roland was out of the car, and he was in intensive care, and he was alone and in the intensive care unit in Florida, and family had to fly down to help him, and Roland passed 6 days later. So they are very dear to my heart. This is why I do what I do. It's a very, I know they're looking over me right now, and doing this presentation because they would want you all to make sure that you had the conversations, because we never know when our time is. And I just feel they brought me to you. So that's why they're on this screen, because I do everything I do with you is for them. So my next slide is me and Kathy in Rhode Island, and I got my regional trainer with Kathy. And like I said, I've been a nurse over 20 years, and I think, you know, you can go into as much education, and unless you walk in someone's shoes, you truly do not understand what families are going through. And that was very clear to me when the more I do my work, is to really get to know my families, really get to know my clients, my patients, is to try to imagine what it feels like to be them, and to understand what they're going through. And having these conversations has been truly a blessing for me, because people say, Michele, how can you do hospice? It must be so depressing. And it truly isn't. The families and the patients that I deal with daily, they have given me just so much joy and gifts beyond. So the conversation is truly about the person telling you their wishes. It is about giving a sense of control over their health care. It's about truly getting to know them in a very unique way. So when we discuss tonight having the conversations, you're going to be able to really plan out how many conversations you should have with these people. You know, if you want to break down the conversations to multiple conversations, or, you know, one conversation, that's going to be how you would like to present. You'll understand that person, and you can present it in whatever way. This is the way you'd like it to be done with that person, and only you know them the best. So that's going to be up to you. So I wanted to throw this slide in because this is what I see daily. And 92% of people believe it is very important to have this talk. And then we only have 32% of the people that actually have the conversation. So, you know, again, everyone thinks it's a great idea, but maybe we'll do it another day. And then we have 21% of the people say they haven't had the conversation because they're very, you know, they're worried that they're going to upset someone, they're going to upset their loved one, and they're going to hold off. 53% say they would be relieved if their loved one asked to have the conversation. So, and 95% are willing or want to truly talk about their end of life wishes. So just things that, you know, are good to think about and realize people do want to have these conversations. It's how can we bring them up where people aren't so uncomfortable. So 97% of the people say it is important to put their wishes in writing. But I want you to think right now on the people that are on this call, are your wishes in writing? And we're going to be talking about that tonight, because only 37% actually have done that. So I'm going to pause on that, and really in a blink of an eye. So a lot of us are in healthcare, and like I said, I was in healthcare. I'm still in healthcare, but in a blink of an eye. So 3 years ago, so you had heard about Gail and you heard about Roland, and you know, that was very powerful for me. And I've also been in healthcare. I've also been in hospice, and I do this all the time. And you would think, here I am doing these conversations all the time, having my wishes known. Well, 3 years ago, it was June 12th, 2017. You know, here I was in my 40s. I have 2 beautiful children. I'm pretty, you know, I'm young. I was only in, like I said, I was in my 40s, and but I was busy. You know, I was in hospice, very, very busy, very stressful position. I woke up that morning and I had been dealing with a health issue. I had a pulled disc in my neck. So I tell you that because I don't want you to think I was too crazy, but I had a pulled disc in my neck from a car accident previous. And I said, you know, I had been waiting for a while to go to a doctor. I went to a doctor, and the doctor said to me, I had been waiting. I'm sorry. So the doctor finally got me in on that Monday. So I went into work Monday morning, like nurses do, right? I sat at the conference table. I was with 15 other nurses, and I thought I had a pinched nerve in my neck, and I told everyone, "Geez, God, this pinched nerve is really bad." I said, "I'm getting pins and needles all in my face." So one of my nurse friends got up and gave me a nice massage. And I said, "No, that's not helping." And I said, "Thank goodness I got this appointment." I drove myself to the doctor's. And when I got there, I was drinking my coffee, and it was like I went to the dentist. I had like Novocaine, and it dribbled all the way down my chest. And nope, I'm a nurse, didn't think anything of it, walked right into that doctor's office, sat down, told him this bizarre story, how my face is going numb, and I just had coffee down my face. And he said, "Michele, can you squeeze my hand?" And I had one side, my left side was going weaker. And I said, "Well, that's because I have a pinched nerve in my neck." And he wanted to rule out, he said, "You have every sign of having a stroke, Michele. I need to rule this out." And I said, "You're crazy. I have a pinched nerve in my neck. I'm not having a stroke." Thought this guy was crazy. But I listened, and I went to the hospital. And by the time I went from his office to the hospital, I got to the front door of the hospital, and my husband was at that door. And I became a patient. And I tell you this story because when you are in the shoes of a patient, it was incredible. I was then looking up at people that were then the nurses and talking. And they were talking over me. And she was asking if I was okay. She was asking me if I could kick my foot. I was talking, and I thought I was talking clearly, but I guess I wasn't. And my husband started petting my head, and I could not figure out why he was petting me. And his eyes filled with tears. I could not understand why his eyes were filling with tears. And I kept talking to him, and I didn't understand why everybody was looking at me so strangely. And I heard a code stroke, and I didn't even think it was for me. And I was on that stretcher. Well, guys, I was having a stroke, didn't even know it. Were my wishes known? No. Could I communicate them? No. They were all trying to ask me. It was the worst moments of my life when you can look at your husband and see the scared look in his face, and you cannot communicate what you need him to know. I couldn't tell him what they were asking me. They kept saying, "Squeeze my hand. Tell me if you're on a machine, Michele, do you want to be on a machine?" And I was answering, they couldn't understand me. I was only 40 something years old, 47, 46 years old. I thought I had more time. It was the hardest day. I couldn't tell him so many things that I needed to tell him. And I saw how scared he was, and I saw how many decisions he would have and had to make for me. So I have been given a gift. The hospital reacted wonderfully. They were able to save me, but I was paralyzed for a very long time for me. Well, it was a godsend. I am able to function now, but I'm also able to give this presentation, and I'm able to go on and hopefully have people put their wishes in writing. And I'm here mostly not only for our clients, but I'm hoping that all of you on this call, however many are on tonight, I hope the one thing I leave with tonight is that my gift is for you to put your wishes down. And then I hope it ripples onto, maybe you could, maybe your friends will do it, maybe your parents. It's so important to make your wishes known, because it's hard being a patient, and all those nurses on the call, we are the worst patients, just so you know. So this is why it's near and dear to my heart. I've been on both sides of the fence. It's made me I'm much more successful at having the conversations through COVID. I'm a COVID nurse now. I work on the COVID units. I probably do about 16 conversations a day. My patients are all ages. It's been difficult, but the one thing I do on the spare time is I go out in the communities and I just really ask everyone to have their wishes done before, because we don't know. And COVID, we are seeing let me tell you, there's so many people coming out of COVID. So yes, we're doing great, but there's so many people that are ending up needing, ventilators, and depending how sick we are, but we really need to make our wishes known. So some considerations before having the conversation. I'd really like you to know what type of conversations you're having. I would recommend everyone, on this call, a conversation should be you should have it with someone 18 and up. So, I go out and I even start, like, when they're going to college. It's important. It's important for them to know your wishes, because there could be accidents, anything like that. So again, 18 years and older should be having the conversation. So, and again, it's so important, again, with advanced care planning, with IDD, we're going to be talking about intellectual developmental. I don't care if we have dementia. I talk to everybody about what our wishes are, because everyone understands and they can tell me what they truly want. So mindful interactions, again, how is the client's health? So when you look at your client, we're going to be talking about, this is going to kind of give you a little bit of leeway here. I want you to take a look, and this will be you can judge the person about how many conversations you can do. So if the person is in great health, we might be able to stagger those conversations, make them a lot more detailed. If they're in fair health, we might have to condense them. If they're in poor or high risk health, we might have to have just a conversation. We might really need to get these in order. And again, if you are struggling yourself because it's a more medical conversation, there's palliative teams out there, and they'll qualify if they have multiple chronic conditions. So you could ask the primary care physician that you're working with for that person. You could ask if they qualify for a palliative care consult. And those that's what we do, and that's what we do well, is having these conversations. And you can sit in with them and have the conversations if they're willing to have you sit with them, and you can learn just by listening. So again, conversations are repetitive. No, you can't mess them up, you know, just it's just having a conversation about your wishes. So the more you have them, the better you're going to get at them. So again, chronic conditions, if people have asthma, diabetes, cancer, bronchitis, congestive heart failure, all of these are adding to chronic conditions. So a chronic condition is something that is just not going to go away. Okay, so if people have multiple conditions, this is when I score them a little bit lower. So they go from, you know, well-being to fear to poor to high risk. So my high risk patients are usually people with like cancer, COPD in later stages, multiple chronic conditions. Those are my high risk. Multiple hospitalizations, they keep getting pneumonias, things like that. Those would be my high risk patients. So just to give you an idea. So the other thing I'm going to focus on right now is a little bit of mindfulness. We are in a very fast-paced society, and our minds are going. And the one thing I learned about being a patient and also being in hospice is your presence, your time means the world to a patient. And it is, in healthcare, we're always multitasking. And for you to just be able to do that one thing, just devote your time to one thing and to that person, and give them your time, and to be present for that conversation. Think of how important, think of what you're asking of them during that time. I also ask that we know when someone's truly not listening to us, and then how does that make us feel? So mindfulness has become a part of my life. I do this every day. I start my morning with a mindfulness exercise. It has been the best thing I think I've ever given myself. It's the hardest thing I think I've done. I had to start. It's funny because they asked me to sit still for a minute. And in the beginning, I couldn't do it. I was like, a minute, Michele, you can't sit for a minute. I really couldn't. It was like pulling out my hair. I couldn't. It's like, oh my goodness, I can't do this. So I'm good now, guys. I can do like 10 minutes. You laugh, but it's true. So I'm going to practice mindfulness with you because it was such a gift to me. And you're going to realize how wonderful it feels to actually be able to sit, have a conversation with someone, and truly listen to them and be present. And just to be so, you know, I am a better wife. I'm a better mom. One day, my son said to me, this is how bad I was multitasking. I'll throw myself under the bus. I was a manager, like I said, at the hospice, and you know, I'm over here trying to be like Martha Stewart. I'm over here in the basketball, you know, world, trying to watch my son, and trying to be a manager and trying to do all these things. You know, you trying to be Superwoman, right? And he looked at me and he was talking to me, and I've got two phones. I got them both going, and he looked at me and he said, "Hey, Mom, can you listen to me with your eyes?" Oh my God, it crushed me. Can you listen to me with your eyes? And he caught my attention. It was so raw, so real. And I put everything down and I said, "Michele, what are you doing?" And now when I go to his basketball game, I'm there and I'm present. That's the next gift I want to give you. Be present with whatever you do. Be present for the conversation. And I guarantee when you listen and you listen to their wishes and you know them better than anyone, you're going to make for the most beautiful journey for them. So when we have our conversation this evening, it's just simple things. There's, you know, when I have these conversations, people say, you know, you did such a great job with my mom, you know, at end of life. And I really didn't do much. I truly just listened, and I did what she asked, and I gave her wishes. And they don't ask for a lot. They just ask what's so meaningful to them. And they know when you're listening, and they know when you want to be there. So again, I'm gonna ask, you know, tonight when we do our mindfulness, it's your gift to yourself, is allow yourself to slow down, allow yourself to be present, even for tonight's conference. A lot of you might be multitasking. You know, you might be listening to me writing your grocery list. You might be listening to me, you know, trying to file papers. We're always trying to multitask instead of just allowing ourselves to do one thing. And what I didn't realize is we're only supposed to do one thing at a time. So anyway, conversation considerations. In planning that conversation, it is important to determine the capacity or ability of the client to choose who they trust. So again, I found this really difficult. I did a lot of research on, you know, what is capacity, and, you know, how do we determine, and, you know, that could be a whole nother topic for you in another conference. But what I do know is it is such a difficult thing, you know, when we are in the hospital and we're trying to decide if somebody has the capacity, decisional capacity to decide. What I always tell the doctors, or what we do clinically, is you explain everything to everyone. And when it boils down to it, you know, whether they have dementia or they, you know, I had a patient end stage dementia the other day, and she was sitting with her husband, and we were discussing wishes. And he said, maybe we should take this out of the room and discuss this elsewhere. And I said, well, you know, this is about her. You know, we could discuss it with her. And he looked at her and he said, well, maybe we would upset her. And I said, well, I think, you know, she might, you know, when we explain things to her, she would feel more in control. I said, tell me about her. How was she when she was you know, before the dementia? So he explained her and how she loved to have everything in control. So here was a woman that was end stage dementia, and the more I talked in front of her and with her and to her, the more she responded. And he saw that, and he saw she was behind her eyes, and he embraced her. And so I feel, this is only my opinion, and you can take it for what it's worth, is they're there, you know, no matter what stage of dementia. They know, they hear, they feel. They might not be able to communicate the way we're used to, but I can feel their feelings, and you can sense what makes them happy, and what they want. So I encourage that you are their voice. You know them better than anyone else. So what we try to do is encourage, you know, we speak just like they were there and with their loved ones. And that's what I encourage. So that's what I'll encourage you to do. So some forms that I will recommend, forms needed to have the conversation. They have beautiful resources, which I listed in the end, but there's 5 wishes, which is nice. It's very casual, and it comes in a booklet form. They have a website that you could use and do group activities or invite a speaker to come. They have a video if you'd like to use something like that, if it would make you more comfortable. The Conversation Project also has a nice website and has a ton of information. So the advanced directives and living will, which again, you can have the conversation, but you can also document the conversation. They're state specific, and I have resources at the end, but advanced directives and living wills, they're just things that you're going to put in writing, but they are for the future. They're for future events. These are things you can do at any age. You can do them when you're healthy. Okay, so this is your conversation, but I'm going to take it to a different level. I'm going to write it down, which is what I'm going to encourage you to do. The next thing we're going to talk about tonight is the DPOA, which is the Durable Power of Attorney of Healthcare. Okay, this is someone we're going to pick to speak for ourselves, and I'll get to that in a minute. And then we have a do not resuscitate order. We're going to go over a do not intubate order that we're going to go over. The next two is called a MOLST or a POLST, depending what states you're in. And the MOLST for me is in Rhode Island. We use it. It's a hot pink form. This website is amazing. So I put that on the resource guide. This is out of New York, and they have a wonderful video. They have amazing resources. But this MOLST and POLST form, what I use them in hospice and palliative care a lot, because it's for if you have 1 year left in your lifespan. So this isn't something that you should be doing with all of your clients or for yourself. This is if you have a terminal diagnosis. But unfortunately with COVID, we've had to initiate a lot of MOLSTs. So what is great about the MOLST is if you are working in a home and one of your clients is using a MOLST or a POLST, we put those on the refrigerator, and what we do is we can transfer that. It has to be signed by a doctor, but the EMS rescue, everybody will honor it. So that's the difference. So advanced directives we're going to be using at any time, but the MOLST POLST is usually at 1 year. Okay, again, this is really doing something is always better than doing nothing. Please remember that. So a lot of people won't have the conversation because they say, I'm not good at the conversation, I don't know what to say. Please, something is better than nothing. And what we're going to do is we're going to practice definitely tonight on each other. Well, I'm going to practice with you, and then I'm hoping that you'll feel comfortable enough that you can go and find a victim in your own home. So what you would do is, let's just start out. We would welcome. So what I would recommend is first you want to kind of plan your conversation, like pre-plan it. So what you would want to do is really, figure out, what type of, remember we said what type of conversation. We're going to do a warm welcome for that person. So, I'm going to just use Kathy's name as an example. So if the person was coming to me, I would, I would say, hello, Kathy, how are you this evening? Would you like to come in and sit down? And I would have her have a seat. I would sit facing her. And I would, again, begin by stating why we've gathered today. So hello, Kathy. I would like, we're here tonight. We're going to have the goals of care conversation. And I would want to make sure that she understands what the conversation is. So again, I just want to make sure that we're here tonight. We're going to be talking about goals of care, which is just some of your wishes. We're going to be talking about some wishes in healthcare and see how you feel about, we're going to be asking you some questions. See if you're comfortable with how you want to be, if you weren't feeling well in the future, how you might want to be cared for, or people that you want in your life to make, to talk about how you want to be cared for. if that's comfortable for you. So you want to always ask the person, or ask, like if we're using Kathy, we want to ask Kathy if she's comfortable having this conversation, and you want to pause and wait for her response, and let her answer. And again, I think one of the other things I want you to do is when you have the person sit down, I want you to make sure you're sitting at eye level, and I want to make sure that you're facing the client. The thing I see a lot happens is when someone brings another person into the conversation, we will sit both people down and they do not talk to the client. This is about the client. We want to talk to the client. So I make that clear. So if Kathy were to be bringing in her husband, or if Kathy was to be bringing in a friend, or if Kathy brings in anybody with her, I will introduce myself to that person. And I say, oh, I'm honored to meet you this evening. You must be so special to Kathy for her to have you into this conversation. And then I direct everything to Kathy. And I will do this even if the person has dementia or any other illness. This is about that person. And if the other person tries to take over the conversation, I am very polite, but I will refocus it back to the person that I'm having the conversation with. Because again, I gently remind them that this is about Kathy, and I want to hear from Kathy. So it's important to hear from Kathy because I need the family to hear from Kathy. Okay. So I like to tell a lot of stories because stories stick with people versus facts. So when my grandmother was ill, we were all brought into this room. She wanted her family surrounding her. And we were told that she had cancer. Okay, now I was in hospice at the time. That nurse taught me one of my biggest lessons, and that's what she did. She walked into that room. She pulled up her chair. She greeted the whole family, and she looked at my grandmother and she said, Mary, you have the most beautiful family. And my grandmother glowed. She was like, I do. Look at my family. And she introduced everybody in the room and bragged about us all, which she would normally do. And then the nurse looked right back at my grandmother and she said, and today is your day, Mary. We're here for you. This is all about you, Mary. And she kept directing it at my grandmother. Now, before that nurse came in that room, I was controlling my grandmother's care because I was the nurse in the family. And it was taken from me. And I was like, what are you doing? This is my grandmother. I'm protecting her. And when no one has the right to take away your care. My grandmother was 82 years old. She was alert and oriented. She had every right. And, here I am. I was this young nurse. What, when did I take over? But in the hospital, everyone was directing the medical towards me until that hospice nurse came in and she sat down and I got to hear what my grandmother wanted. It was the most powerful moment for me. And that's when I changed how I do my conversations. It's changed how I do everything. When you hear from that person what is important to them, it helps, and it helps the family. So just sitting facing the client was one of the most powerful things you can do. And it helps the family. So again, a lot of us have those families, and those families, the families that are like, she wants this, and you're sitting there going, oh my God. And they speak for the other person. It'll be the first time that you can empower your client. So again, that's sometimes what the client needs. And you'll see that the client you will gain the trust of your client so much because they're like, oh my gosh, I can be heard. And it's a wonderful feeling. So you can help. So we're going to just take a moment right now, and I'm going to have you just sit tight. I want you to do me a favor and just play along with me. So I want you to be able to sit in your chair, if you're sitting in your chair, and I want you to close your eyes for a moment. And I want you to sit comfortably. And I want you to bring your attention to your breath. I want you to take a deep breath in through your nose. And I want you to breathe out. I want you to take another deep breath in through your nose. Slowly breathe out. One more breath in. I want you to just sit with your thoughts. You have nowhere to go, nowhere to be. You're going to give yourself this gift of allowing yourself to think about your wishes, go into your own future. Tonight is about you. We're going to lead by example. Take a deep breath in. Take a deep breath out. Slowly open your eyes. Okay, now we're going to talk about our wishes. For those of you who do not have their wishes known, we're just going to think about what we want for ourselves tonight. I'm having the conversation with you. Because remember, if we cannot speak for ourselves, we have to pick someone who we would want to speak for ourselves. And I don't want you to pick someone, I don't want you to pick someone that you think you should. I want you to pick someone that would honestly represent you. You don't have to make this decision tonight, but I want you to think about who's going to speak for you, who's going to honor your true wishes. Okay? Because this is difficult. It's a difficult decision, but you know, do you feel like you could share that with someone? Do you feel they would honor your wishes, not change your wishes, or break under pressure, because it will be a difficult time. Okay, and you'll be able to have this conversation with them. So again, and I have to laugh. I don't want you to say, "Oh, he knows. I picked my husband. He knows exactly what I want." No. Let me tell you, I told you I'd tell a lot of stories, but let me tell you, when I went through my stroke, okay, and I saw my husband, once I was able to come to, and after the stroke, and you're able to laugh and things like that, we had this conversation, you know, and now, mind you, he was my best friend before we got married, my very best friend. And we've been together now, we're over 20 years married. And I thought he really knew my wishes. So I was like, well, what would you have done? Well, let me tell you guys, he didn't get one thing right. He didn't get one thing right. I told him, I said, I do believe I'd go to heaven, but let me tell you, I would have haunted you. He did not get one thing right. And but in his defense, I didn't get one thing right with him. Now we're best friends. We have a very good communication. And so I tell you that story because yeah, I have everything in writing now because you know, I told him, I said, I would have wanted you to donate my organs. And he goes, oh God, no, I wouldn't have done that for you. So I said, well, I would have donated yours. And he goes, you better not have donated my organs. Oh, goodness gracious, we wouldn't have done well together over here. So we laugh about it now, but I tell you that story because, you know, here we are. We're still married after it, but we laugh, but it also brought up a great conversation with my parents. My parents have been married over 50 years, and they didn't have their wishes known. And I had the stroke. We had, here we are at Thanksgiving dinner, and that's why I picked this picture, is I had my whole family at the Thanksgiving Day dinner. We were laughing so hard everybody was laughing at me and my husband. And as they're all sitting there, they started asking each other this. My aunt asked my uncle asked my aunt. Do you know, not one of them no one had the right answers for each other. So needless to say, our Thanksgiving dinner turned into everybody knew their wishes. And then it turned into the kids and things like that. So we all have our wishes known, but it turned out to be honestly a hysterical conversation that we were able to laugh about. So it wasn't a morbid Thanksgiving, but yeah. So but I want you to pick someone that you feel will represent you, that you feel you could be, you know, very open with. So again, that person is not taking over your wishes unless you can't speak for yourself anymore. So you don't feel like you're handing over anything. And the durable power of healthcare, again, is of your health, not finances. So if you're looking to like write wills and things like that, that's a different story. I am only doing healthcare. So this is a person that you want to talk to them about just your health. Okay. The person should be over 18. And again, when we start really looking into, you know, people that are taking care of people with group homes and in like assisted livings and nursing homes, you cannot or should not have, those people are not supposed to be a part of, can't be your durable power of attorney. Or you would have to actually get a lawyer, I think, involved in that case, or check with your state, please, because there's your healthcare provider, including owner or operator of a healthcare facility, anything like that. They'll question if you have the same person, your durable power or your witness. So again, please look into that as far as who you're choosing. They also need you to pick not only a durable power of attorney, they need you to pick a second and a third. And the reason that we ask you to pick a second and a third is if they lived out of state, or if if they lived out of state, or if, you know, we couldn't get in touch with someone. So again, we'd always go to the first person, but if not, we'd go to the second or the third. The other thing I wanted to bring up is if you do not have one, what they will do is they will go to us. What we do in Rhode Island, and I think most states, is we go to the spouse, then we go to the adult child, then they will go from there. So they will pick then. And again, if there's a surrogate, they will pick the surrogate. The next thing that I ask, again, we will ask you can ask yourself, you can ask your loved ones, you can ask your client. It's extremely important. Does the person understand their medical condition? This is important. I ask open-ended questions. Don't ask yes or no, because I'm trying to really understand. Can you tell me about one of your medical conditions? Because this will let me know truly if I'm on the same page as the person. Okay, so what do they understand? That's going to open up a world of where this person is with having this conversation. So I even asked them why they were brought to the hospital. So when you can understand where they are, this will explain and open the door of their acceptance. This will open the door of what they understand, and this will help you understand how you can have a conversation, what level I need to talk to them at, and you know, do I need to bring in resources? So again, a lot of you might not have, you know, a nursing degree or understand a lot of the medical conditions, and that's fine. We can get resources. We can get books together. We can read books together. That's what we do. So when I don't understand something, I say, well, let me get a resource for you. And then we look at the book together, and we can get, you know, or I'll find the resource that I need to. That's all we can do. And because again, we're not supposed to put our opinions on anyone. What we do is we offer a resource, and when we offer that resource, we say to the person, you always ask, and how does that make you feel? How do you feel about that? So you never answer for them, because it's not your life, it's their life. So again, it's how does this make you feel? And again, we don't know how that feels to them. So I would recommend you to say, you know, I sometimes don't say anything at all. Listening is such crucial. So sometimes I'm just silent, or I will say, that sounds like it must be hurtful, or something like that, I'll say. And then they'll go on again. When, after that, we talk about wishes. This lets me understand, you know, again, I'll say to you, you have to remember, we plan for everything in our life. We plan for everything. We plan where we're going to go to school. We plan our jobs, our careers. We plan if we're going to get married, if we're going to have kids. We plan everything. Retirement. You need to plan end of life. Okay, so what are you comfortable with? And, you know, I would like my friends to visit. I would like my family to visit. You know, again, some of us like certain family members, some of us don't. I like to be alone when I don't feel well. I don't want all these people in my room. I want to talk about my life. You know, things like this really mean a lot to people. I want religion. I want spiritual visits. I want to be home. Some people don't want to be home. They want to be in a hospital. Some people want to be in a nursing home or an ALF, or where I call home, or again, the group home, or anywhere like that. Okay, again, wishes for comfort is extremely important. I don't want to be in pain, but I will have family members at the end of life, or even when someone's struggling, you know, again, I want medicine, but they'll say, don't give her too much. I don't want her sleepy. So we have to find a good middle ground. So this is important. And again, why am I having these discussions now? Because we don't know. Like I said, we don't know when this would come up. Now, the other thing I want you to know is we should, again, so you might say to me, Michele, I'm in my 20s, or Michele, I'm in my 30s. That's okay. This can be changed. I don't care if you change it every week. I don't care if you change it every month. I don't care if you change it every year, whatever. It's when you feel like it and you want to change it, as long as the complete document gets changed. You can't have two documents. You have to get rid of the one you want okay? But you can keep updating. That's very important. Okay, so again, there are so many documents. I use some of these from the 5 Wish booklet, but it's important that they actually get into this much detail. But right now, with how things are going, you can have massage therapy. You can have bed baths, you can have showers, you can have mouth care. You know, it sounds very basic, but this is very important to certain people. One of my favorite stories is music. Okay, so many people love music, but when you can't speak, and let's, you know, again, we're on dementia. Okay, so dementia, music is amazing, especially with playlists that they loved. You can trigger where I have dementia patients. I had a dementia patient who hadn't spoken in 2 years. And when I got the playlist, they actually were singing the songs. It was beautiful. But my favorite story was I was in the intensive care unit, and his name was Norm. And he was so sweet. He had it was his last day of life, and he was on 15 liters of oxygen, so he had a face mask, and his granddaughter and daughter was sitting next to him, and he had this big mask on his face. And Norm was fine. He wanted to be in the ICU. That's where he wanted to be. He was content. He was very religious, and he told me he was going home. And I said, home, Norm? I thought he wanted to go home. And I said, where's home, Norm? And he pointed up. And I said, oh, you're going home. And he said, heaven. I said, okay. But he wanted music. So, and he wanted to pass in the ICU, which is not your norm, but he had so many incidences with his COPD that the ICU became his home. He loved the staff and they loved him. So he has his face mask on and he wants music. So I've got the granddaughter and the daughter at bedside. And with all that oxygen on, he can barely talk to me. So I directed the conversation to his daughter and his granddaughter. And I said, well, what kind of music does Norm like? And so the daughter goes, oh, he loves the gospel. And the granddaughter goes, oh, yes, gospel it is. And then the granddaughter says, wait, no, I think it should be, no, I think it's jazz. No, jazz. So now they're going back and forth. No, jazz it is, jazz. Well, I go to walk out of the room. I'm trying to get the music because I got to hurry up and get the music, and I want it to be perfect for him, right? And he lifts up his mask, and out of this breathless whisper, he goes, country. And I said, oh my goodness. I laughed so hard because I said, here we are, end of life. We can't even pick the music out right. He wanted country. Can you imagine if we're playing? Can you imagine? Here we are. You got to make your wishes known. We would have been playing Norm. All he wanted was music. And we would have had gospel on. We would have had jazz. The family thinks they're doing the right thing. He wanted country. So I laugh. I think of Norm every day when I play this slide because I said, Norm, I am going to make a slide and I am going to put music and I'm going to ask every family member what type of music, and I'm going to say it's for you, Norm. So that is my Norm story. Because other than that, we would have been playing jazz and everything else when the poor man just wanted country. So it would make a difference. I don't want to hear rock and roll or anything. If my kids ever played their music, I think I would, oh, I don't know. So anyway, again, now we're into, there's a lot of people who love aromatherapy, but again, it's going to depend. What aroma do you like? Some people love prayers. I have so many patients that I can calm and I can relieve pain. The family will say, what pain medicine did you give her? And I'll say, it's called prayer. And they laugh because they think like I gave her some wonderful medicine, and I did. It's just power of the word. So again, we use prayer sometimes, and that helps people. So non-farm is amazing. So again, some people just want their hand held. Some people just want pictures in their room. Some people like sound machines. So this is wonderful. Wonderful wishes are very important. Some people just want to write down what they want their friends and families to know. So that's another thing that they can do. You know, they can, they want to know certain things. This is something that we do. We write legacies and things like that for our families. So again, you know, this is something that you can do a legacy book even now. So you can have things as you go and write down. So medical conditions. This is really good. I like to have these, again, families don't know what they don't know. And again, you know, I'm in medical too, and there's a lot we don't know. So I have to give credit. You know, I was researching because I like to break it down. I don't want to sound medical when I talk to people and families. I like to be very, you know, so they can understand, because you know, you don't want to speak above anyone, or you want them to understand what you're saying. So I found on the VA website, it's probably one of the best I've read. And and I did not give them credit because I just found it right before this evening. So it was U.S. Department of Veterans Affairs. So they came up with a beautiful new set. It's setting healthcare goals. And they have 2 beautiful workbooks that you can download. So it's amazing, but they really get into explanations. So I'm going to explain to you the unconscious, coma, and vegetative state. So again, a coma is a state of unconsciousness. And so when I'm having these conversations, I ask a family if they, you know, if in the future, if they were to become unconscious, or they go into a coma, or they're in a vegetative state, how they would want to be cared for. Okay, and I say, do you understand what an unconscious state is, or a coma? And a lot of times they're going to have questions. So I'll say to them, the unconscious state is usually, you're going to, they don't usually have pain, you know, signs of pain or distress. If you're in a vegetative state, you may open your eyes, you may look like you're awake, but you're really unconscious because you don't have any sensation of awareness. If you're in a vegetative state, you may make movements, you may yawn, you may smile, you may pull back your arms or legs, or you may look like you're watching something or responding to someone, but really these are just reflexes. But you're not feeling pain. Sometimes you have no awareness, and you can't interact in any way with the world around. So what's it like? What would I feel, or how would you feel, or how would you understand? People sometimes who have come out of a coma or a vegetative state usually say that they don't have any memory or awareness of the time that they were unconscious. These people usually say they don't remember any pain or discomfort. And a few people say that they were aware of things going around. So I always tell people, hearing's the last to go. They can always hear you. So we would always, you know, make sure we were speaking to you. But, you know, they would say, you know, how would I be fed? We'll be talking about they can be fed through a tube, through a feeding tube. A lot of times you would have to be washed and dressed. You know, with a gown on, you'd stay in bed. We would turn you every 2 hours. What's likely to happen? What I try to explain to people is, if you were in a vegetative state for a long time, what experts say, or the medical people say, is the longer that we are in a permanent vegetative state, maybe more than 3 months, that's caused by illness or injury, recovery is usually 0. So a lot of our advanced directives, it will allow us to state, if that happens, what do we want in place? So again, I like the 5 wish booklet because it would say, if I was young, it might say to me, if I were to be put on a machine, a ventilator or anything like that, and I'm on a machine, what do I want? And so that's going to change. Like if I was young, I might want to be on the machine and see what happens. And if I am in a vegetative state and that's not what I would want, I don't have any brain activity or anything like that, I don't want to live on a machine for the rest of my life. So you can actually, in some of these booklets, write down that, no, I do not want to be left on a machine. If there's no brain activity, please, unplug me. And what that does is it allows your durable power of attorney to say, hey, let's try the machine. And if in 3 to 4 months there is no brain activity, then she doesn't want to live like this. She's giving me permission to unplug her. So you're relieving the guilt, and you're having your wishes known. So again, that could be for a sudden issue, but again, when you're discussing your medical wishes, your medical conditions, when you have someone, like I said, with dementia, it's really important. If I'm having this conversation, do you understand dementia? It's a chronic condition. Alzheimer's, it's progressive. It's a progressive chronic condition. This is going to get worse. And we explain what's going to happen and how we're going to give them the best quality of life through every stage of dementia, but we're going to stay in front of it. So what do we want? This is why, a lot of families will go, I don't want to talk about it right now. No, now is the time to talk about it. Because if she can't talk anymore, how are we going to know what she wants? Okay. So it's good to have those conversations early when the person can still make those wishes. So that's why dementia is probably the families, in the beginning, they do get a little, I don't want to upset her. And it just takes a little time with those families. And I just say, we just want to embrace her now, and we want to make sure that we're doing everything that she would want, and we need her to tell us those wishes now. So the life-sustaining measures. So these are the things that could help save a life is CPR, dialysis, feeding tubes, and ventilators. So it's really important for the people to tell us what they want. Again, if we're young, we might say, yes, I want all of it. But again, as the person, as they have certain conditions, they may not want certain things. And this is where COVID came in. People were changing their minds at a young age of wanting things, but it was also just as important at a young age, especially with my Down syndromes, saying, yes, I want a ventilator. So I was going out in Rhode Island and asking people to please let me know their wishes, because I want you to come in through that door, and if you want that ventilator, I want you to tell us. Okay. So it was just as important to get your wishes down, yes, I want everything, than it was, no, I don't want anything. So I was doing the fight, and I'm still doing it. Do we want everything or do we not? So I want it both ways. I want it written both ways. So CPR, what's really important for everyone to understand what CPR, it is not like it is on TV, okay? People do not perform CPR Okay, this is where my families think, I keep saying to my families, you know, if you have congestive heart failure, if you have a cardiac condition, you have a weak heart. And if your heart stops, the only time I'm going to do CPR is if your heart stopped. It's done. It's stopped. That does not mean, okay, this means I found you. There's no more pulse. There's no more heartbeat. I have to start a pulse. So I'm not sure how long your brain went without oxygen. Okay. So if you want CPR, if you are a full code, you could have been a very long time without oxygen. Okay. So if I start CPR, okay, it doesn't mean that you are going to come back like you were. And a lot of families think you're going to come back not only like you were, some of them think you're going to play another 18 holes of golf. And I'm like, absolutely not. So we have to have these conversations. I have to explain to them where their person is, and truly, what are we going to see from CPR? Because we have to be realistic. Okay. So what CPR is I'm starting a heartbeat. I am going to push up and down on your chest. I am creating an artificial breath for you. I am going to have to get drugs into you sometimes to stimulate that heartbeat. I'm going to have to use a defibrillator sometimes, which is going to be a machine that gives you a quick electric shock. And sometimes we're going to be talking about that is we may have to put a tube into the windpipe to create breath. So again, putting you on a vent or a machine. So it's going to depend. There is no right or wrong answer for CPR. It's what the person wants, but it's explaining it correctly. And again, anytime your brain is without oxygen, okay, that is when we see the person not come out of it the same. So your brain needs oxygen. Okay, so having the CPR talk is very important, but it depends. You have a very young person, you know, usually CPR is, you know, they're going to be full codes. So that's another whole issue. It's the sicker they are, the harder those conversations are. Dialysis is a medical procedure that filters your blood to remove wastes. It's a product when your kidneys can no longer do the job. So we're going to explain to them that this is a machine that they're going to go on, and it's going to help to do the kidneys. Now, what I explain in detail is sometimes I, you know, show them the machines on, you know, and again, you can use your computer, you could show them what the dialysis machine looks like, but they have to understand this is a long process that they have to sit for hours. It's about 4 to 5 hours, 3 days a week. It is very grueling. So is your client going to be able to do dialysis? So it's not just, hey, let's try dialysis. It's truly, can they handle the dialysis, the amount of hours it's going to take to, you know, hook them up to the dialysis. I'm sorry, I wasn't exactly paying attention to my slides over here. So again, the dialysis machines, you know, are they going to be capable of sitting through the dialysis machines itself? Okay. Then we have the feeding tubes. Now, again, the feeding tubes, it's going to depend, again, who am I looking at? Where am I, you know, am I talking about someone who needs a feeding tube? You know, feeding tubes can be put in for short term, where I'm just trying to use it to relieve and move on, and or am I using this, you know, my dementia patient, again, do they understand the disease process? Has the person in the disease dementia process lost the ability to swallow? And what does that family and what did that person want? If I lose the ability to swallow, do I want to be fed through a tube in my stomach? And then again, if I'm caring for and overseeing in the group home, I've been called to a lot of group homes lately in Rhode Island. And this has been very eye-opening to me with the feeding tubes, whether it be temporary or long-term, is, doing the teaching of a feeding tube. The head of the bed has to be elevated for 30 minutes. It's going to depend. Is it going to be left doing a bolus feed where we just pour it in? Is it going to be left up for a prolonged period of time? So a feeding tube can be left in, and that's going to be, again, it's a personal decision. So we want to make sure that the family understands what the feeding tube is and what the goal of the feeding tube is. And again, here's the ventilators. This is a good picture. I like this picture because it does look like the intensive care unit. Again, they will be hooked up, with the monitors on. Again, the ventilator, we have non-invasive ventilators, which would be my CPAP and my BiPAP. Again, the ventilators have come in into play with COVID. So we can leave people on temporarily, but we can also have people that have been on, like I said, for months. And the longer they're on, the less recovery time. So it's having those difficult conversations. Why I want the conversations done earlier is having someone getting rushed in with COVID right now. If it attacks the respiratory, they might be coming in with a pneumonia, and it depends how severe, or how severe and what the condition of the person is. Having their wishes known prior, so the family doesn't have to make these decisions. To give you even an idea, I used to be in the hospitals probably 3 times a week before COVID. I'm up to 16 to 18 times a week right now in the hospitals with just COVID patients. And I have to say, out of the 16 patients a week I'm averaging, none. I think I've had the conversation, and my patients are from 32 to 101 last week, and my 101-year-old didn't even have her wishes done. So that's just kind of really showing you the spectrum here. Just to finish up really quick, I know I'm kind of taking up your time. I wanted you to ask some questions, but again, just know that the DNR and the DNI, do not resuscitate, do not intubate. I need physician orders for those, but it's good to bring them up. But what happens is we're going to be talking in the conversation. You can have the conversation to see if that's what they want, but we're going to have to go to the PCP to get the signatures for them to have them honored. Okay. And then this again is for, I want you to do this for yourselves, and I want you, this would be talked about is you have to decide, and again, we plan everything. Is this something that you would like? Do you want to be buried? Do we want to be cremated? Memorial services, discuss with your families where it's held, what you're looking for, types of issues, and not issues, but what you're looking for. So it's very important. People want wakes, they don't want wakes. It's important to discuss these things, and funerals are they're getting very expensive. Even writing an obituary is very expensive for families that we're going through. So these things actually have to be planned out, and financial things have to be set aside. So it's good to talk about. Specific forms. Again, when we sign the forms, we are going to have 2 witnesses sign most forms. A lot of states do not require it notarized, but the more research I did for this particular conference for you, I would just personally recommend it to be notarized, because there were so many things you couldn't, you could have 2 witnesses, but there was so many loopholes. I don't think it's going to hurt to have it notarized. I don't think it, you know, it's not too hard to get a notary. It's just, I think in the long run would be easier just to have it notarized, to be better safe than sorry. And after you complete the documents, if you're having it in writing, the other thing I see is people do this and then they put it in their safe. How the heck, no one even knows the code to your safe. So how the heck are we supposed to get it out? So what you have to do is you have to make a copy. I want a copy given to your PCP. I want you to give a copy to the person you picked for your durable power of attorney. We also had people pick durable power of attorney, but they forgot to tell them they were their durable power of attorney. That's happened so many times. So again, you have to pick the person and tell them you're the person. They should be talking to you about everything about your wishes. A lot of these wishes also have a wallet card. That's great, because if it goes in your wallet card and you go to the hospital, you can bring that with you. Talk to your doctor about it. I want extra copies. And if you are running a group home, a special home, the one thing I am going to ask of you, and because I'm a transition nurse, please, if we could all work together, I would love if we could come up with hospital folders. And what I'm looking for is create a folder for all your clients with their wishes, not only their wishes, but I would love for you to send in, if they ever had to go to the hospital, not only send their wishes with them, but tell me about them, because so often they come to the hospital and I don't know them, and it would help me if you could paint me a picture of them so I could comfort them until you could come in and help me. Because you're their eyes, you're their world, and they're scared. And it's so sad sometimes. My dementia patients, my Down syndrome patients, we had a little girl that was, they thought she was hallucinating, and she wasn't. When her resident care home came in and her resident care staff member came in, she goes, "Oh no, I forgot to send her with her Rubik's Cube." She had been sitting that whole time in the hospital, and she kept looking like she was playing with air. The hospital kept writing down she was hallucinating, and I'll never forget her. And when all of her friends came in, they were like, "Oh, she needs her Rubik's Cube," and they ran and they got her Rubik's Cube, and they ran back to the hospital and they gave it to her. She was so happy, and I was like, oh my gosh, they could have been medicating her for the wrong thing. So that hospital folder would mean the world to us. It would help me understand them and just provide better care. So I hope, I answered some, hoped I made you feel comfortable enough that you could have this conversation. You can always reach out to Kathy. I know I kind of went right up to the whole time that but I will stay on and ask questions, and Kathy can also give you my information. So I will be happy. You can call me anytime if you need me. And the last page is for resources. So thank you all so much.
Thank you, Michele. We have a quick question, one that we can ask in interest of time, and they're more than welcome. Any of you are more than welcome to send them to Catherine or Kathy Bishop. We'll be happy to forward them on to Michele for you. The question is, and this is from a family member, in ID and dementia with COVID-19, we could not anticipate the possible course of the condition. So how does prognosis influence the previously talked about wishes and decisions?
What I would ask for is what your wishes are now, how you would want your life now, just the same, because we're going to do everything we can and walk you through it. So whatever you're looking for now, please make those your wishes. And when you are, if pray you're safe and everything, but through COVID, we walk you through it. So if something, God forbid, should happen, if you're entered into the hospital, we walk you through. We treat aggressively when you come into the hospital with COVID, but we walk you through everything that's happening. And if you do need to change your what's going on, then we can change it as we go, but just make your wishes known for what you're looking for now.
Great, thank you, Michele. And I'm getting wows and great job and thank yous coming through. Just let me announce quickly and remind you all, June 2nd, 6 to 7:30 p.m., same time, that's Eastern Daylight Time. Care for the caregiver, recognizing and managing stress during the COVID-19 pandemic. Helen Stepawani will be the moderator, and she has a couple of wonderful panel participants who have been working to provide practical resources for you on how to take care of yourself. Towards the end of the panel, we will also have a representative on from the ARC of the US who will be talking about COVID-19, the Recovery Relief Fund. And whereas most of you or all of you know, 80% of the funds for those of you who are paid participants on these webinars will go to that relief fund. So we're really looking forward to next week and this panel discussion. This has been absolutely wonderful, Michele. I hope that we will forward questions along to you, and just can't thank you enough for the work that you've done.
Thank you.
Thank you. You have a wonderful rest of the evening, as everyone else as well, and we look forward to talking with you all next week.
Good night, everybody.